Hi, I'm Dr. Kuyunov here at Dental Prosthodontics of Rochester, and a lot of patients are asking us questions about implant restorations, and I'm going to answer today some of the most common questions. So, what is a dental implant restoration? Dental implant is when a person is missing a tooth. Imagine the tooth is being missing. This tooth can be replaced with a dental implant restoration. And what does it entail? When you look here, the dental implant goes inside the bone and it stays there. And that's basically replacing the root of the tooth. Okay, we have the natural root of the tooth, then we have the implant, which is replacing it. On top of the implant, we place a special attachment. The name of it is abutment. And on top of this abutment, we place the crown. So how it looks like, this is the gums, the implant is inside, and the restoration, which in this case is a crown, goes on top of it. So there are really three parts for dental implant restoration. Dental implant crown. Okay, one part is the implant, the other part is the abutment, and the final one is the crown. Okay, and that is a dental implant restoration for a single crown. Sometimes we're missing three teeth, 1, 2, 3, and we place two implants, and it will be a bridge over two implants, like a bridge, right? Imagine yourself, you are missing three teeth. You don't have to replace every tooth with an implant. You can place two implants to replace three and sometimes four teeth, but that's how it's going to work. It's a three teeth being held by two implants, one on each side. That's a dental implant bridge. Another thing that can be done with dental implant restorations is replacing all teeth with dental implants. If you're missing most of your teeth, all of the teeth, it can be like a denture implant restoration. And it can be either a snap-in denture, two implants, and a denture that snaps on it. Okay, or it could be a bridge, a dental implant bridge that replaces all the teeth. Place multiple implants, and it is a one single bridge replacing all the teeth. And that's called a full arch of implants or full mouth implants. What does implant restoration entail? It entails obviously that you are a good candidate for dental implants. It entails placing the dental implant and then placing a restoration over it, whether it's a crown or a bridge or a denture. A good candidate for dental implants is somebody who is medically fit for it, has enough bone volume for the implant, and has good oral hygiene and no contraindication from social or medical, such as smoking or uncontrolled diabetes. How can you make your dental implants white again? So dental implants are inside the bone, under the gums, you cannot see it. But the crowns or the bridge over dental implants is what can stain, and that's what we see. So to make it white, just it needs to be polished by your in the dental office where you go by a hygienist. All it needs is just polishing. Uh, many times it can be done in the mouth. However, if it's a heavy stain and it cannot be done in the mouth, sometimes those crowns can be removed or bridges, they can be removed and they can be polished in the lab in a more with heavier instruments that we cannot use in the mouth of a patient. Is it possible to do screw retained crown restorations of single implants? Yes, absolutely. It is possible to do screw retained. And what it means is that when it's a screw retained, the crown is attached to the implant via screw, and it can be easier removed by just unscrewing the screw and taking out the crown. However, it has to be planned in such a way that the implant is placed so that the screw channel will come out from a crown in a place that nobody can see. Meaning, I'm going to show it to you. If the screw comes out from the cheek side or from the front, when a patient is going to smile, is going to show it, it doesn't appear so aesthetic. However, if you plan it in such a way that the implant screw will come out from the occlusal table, from the chewing place where nobody sees anything, then that's okay. Even if the implant comes out from the tongue space, that's okay. But ideally, it has to come out from the chewing table, and that will be a good path for the screw. Sometimes when the screw has a not very good path, for a screw retain restoration. Then we decide to do a cementable restoration, where the abutment, which is the intermediary part between implant and crown, is being screwed to the implant, and the crown is then being cemented on the abutment, and that's provide correction for the unfavorable path of the screw. How many years can you keep a dental implant? We have now studies that show 10 years, 15 years, and 20 years follow-ups on implants. Um, the more the better. Dental implants can be retained in place for many years as long as you are taking care of them. And this means proper oral hygiene at home and proper follow-ups with the dental office where you are. Sometimes it's every 3 months, sometimes it's every 4 months, or every 6 months, or every once a year. But at home, it's a daily brushing and flossing and cleaning of the implants. If this happens, the implants will survive for many years. If this doesn't happen, a patient will experience some inflammation of the gums. This is called peri-implant gingivitis, or it can be some bone loss, and this is called peri-implantitis. So as long as the oral hygiene is good, it's all great. Now the other factor is medical condition. If the medical condition does not change, and we still have a favorable health for the patient, dental implants should survive. Also, in terms of smoking, if the patient does not smoke, dental implants will survive longer. So smoking, medical conditions such as uncontrolled diabetes mellitus type 2, or other bone density medications, they can pose some risk for implant failure. But if you don't have these conditions, implants can survive for many, many years. How many times can dental implants be replaced? Sometimes zero. Sometimes it can be done a few times. The most important question is, why do we need to replace the dental implants? If they failed, the bone rejected the implant, we want to find out why, what's happening there. And if the implant has failed, there has to be done some type of regeneration of the bone, adding some bone volume, making sure it's a healthy bone. And if it's all good and favorable, then a new dental implant can be placed either in the same location or a nearby location. Um, the exact number of how many times a dental implant can be placed into the same place, it's a question mark that I would not be able to answer. I don't think there is an answer out there. Ideally, once the dental implant is placed, we hope it will stay there forever. How common is dental implant failure? So there are different studies reporting failures of dental implants, but it's less than 5%. It ranges between 2 to 3%, and it's also in general. In general, it's up to 5% over 5 to 10 years. But there are a lot of implants that are being successful for over 10 years and 15 and 20 years, and they are doing well. As long as we remove all the failure or the high risk things that contribute to implant failure, if these are removed, then implant failures should remain active and healthy for many years. But the big number, it seems to me, is up to 5% will be implant failure. What is the most common reason for implant failure? The most common reason is a gum disease. If there is a gum disease that goes around the implant will start losing bone, and once this process starts, it's very hard to keep it clean, and it just continues until implant will fail. This, in my mind, is probably the most common cause for implant failure. That's what I've been seeing in my office coming, is when patients have a gum disease and the gum that surrounds the implant does not protect it anymore, and bacteria goes inside the implant, and slowly in this process the bone is being lost. That same bone that holds the implant in place is disappearing, and if nothing is holding the implant in place, it will eventually fall out. It takes years for this process to happen, and many times it does not happen if a patient has good oral hygiene and he sees his dentist on a regular basis to clean around those implants. The other failures of implants are not really the implant, is the crowns that are on the implants. They can break, and that can be many reasons for this. One reason is that the material that we have used came with some type of problem with it. So it's not even a patient problem, not even a dentist. It's just the materials on the microscopic level. Something happened in the manufacturing and it just fractured. Also, the crowns can break because patients just had beat on something very strong and very hard. It was just this implant crown biting on it. If this happens, we can see failures from crown to the implants all the way with all the parts. If the patient is grinding can also contribute to failures of either implants or the restorations over the implants. Uh, if everything is good, the implant is okay and the crown is okay, the other level of failure can happen at the attachment level, at the abutment level. And the screw that attaches the either abutment or the crown to the implant can become loosened. And if the screw is actually holding the crown on the implant, if the screw is not being attached pretty strongly, it has to be replaced with a brand new screw, and this has to be done as soon as possible, because if we do not address it soon, if the screw fractures, it's a problem to remove it. It may become very difficult to remove it, and then we cannot even use the implant anymore, or we have to think outside the box how to use this implant. Can we save a failing dental implant? That's a good question. Yes, we can stop the process of whatever causes failure for the implant. If it is because of infection inside the bone, we can stop the process of this infection by cleaning out all around the implant and creating a healthy environment for the implant. So say the implant is 12 millimeters long and 6 millimeters of bone was lost, so now we have only 6 millimeters holding the implant. So half of the implant is inside the bone, the other half is outside. As long as we create a healthy environment now by cleaning the implant and removing all the bacteria and having a healthy gum attached to the implant, whatever was causing the implant failure, this disease process will stop, and then you can have the implants for more years to go. I have a specific patient in mind that had the process of implant failure, and she had 5 implants, and each one was losing bone of about 50% around it. All the implants were cleaned, and a healthy environment was created. And it's been now 3 years following up on this patient. There was no more bone loss on those implants. So it's working as long as we create a healthy, bacteria-free environment. How can you prevent dental implants from failing? The most important is just follow with a healthy lifestyle. A healthy lifestyle means that whatever medical problems you have, they are being well controlled. If it's diabetes, the diabetes is well controlled. The sugar levels are not high. If you take any medications that may decrease bone density or affect bone density, that can also affect implants. Smoking, if a person is decreasing smoking and creates a healthier lifestyle, that will improve the chances of implant survival long term. More about it is oral hygiene. The at-home oral hygiene is very important to keep the implants healthy and decrease the failure risk. If you follow with all the oral hygiene instructions as it was described by your dentist in his office, the implant should survive for long term. Also, following up with a regular hygiene appointments. Maintenance for implants is not less than for teeth, it's the same if not more for implants. So following up with the hygiene appointments, professional hygiene appointments, is very important to make sure that if there is any disease process starting, we catch it at the early stages and we address it at the early stages without letting it to progress to the more serious stages of the disease. So absolutely, we can prevent dental implant failures if we follow a healthy lifestyle. How long do implant restorations take? It's usually for a single crown, it's a 2-visit appointment once you have the dental implant. However, if you do not have dental implant and you start from the beginning, the first step will be to place the dental implant. That's going to be a surgical step, and we wait about 2 to 3 months for the implant to get integrated within the bone where it is. After the 3 months of healing period, it's a 2-visit appointment where the first visit is impression taking and the second visit is delivering of the crown to the implant. Start to finish, it's about a 4-month period when you are missing a tooth. However, during this time, you do not have to walk with a missing tooth. You can have a temporary appliance replacing the missing tooth. This can be something like a clear appliance with a tooth in it, almost like an Invisalign type, or it can be a temporary partial denture, or any similar appliance that will replace the missing tooth until the implant is being restored. How do I know when my implant is ready to restore? Your dentist should tell you when the dental implant is ready to be restored. It is usually 3 months after dental implant placement. Sometimes it may take longer time, sometimes less. It's being checked and verified by your dentist to see that it is ready to be restored with a crown in a safe way, so it's not going to break, it's not going to fail. It's usually 3 months, but your dentist should give you the green light before doing anything with this implant. I hope I've been able to answer some of your most common questions about dental implant restorations. For any additional information, if you would like to, please give us a call at 585-471-5689. Thank you.